Which of the following is most appropriate initial diagnostic study to confirm the suspected diagnosis? Okay, 50-year-old man, history of pituitary adenoma, presents the ED with severe onset headache, nausea, vomiting. Okay, on examination, BP is 145/95, pulse 100, respiratory is 18, bitemporal heminopia, left-sided oculomotor nerve palsy, which is probably okay. So what am I trying to think that he has here? Severe headache, vomiting, pituitary adenoma. Okay, so that's probably increasing in size, pressing down on that optic tract, which explains the bitemporal hemianopia, excuse me, and the left-sided oculomotor nerve palsy. I'm having a hard time with that one. Um, hmm. I don't think it's EEG or lumbar puncture. I'm debating between like if you go to see these structures, I don't know if you have to do an MRI. That's my suspicion. And then if he has the severe headache, vomiting, nausea, but then is it just from increasing pituitary adenoma? Or could that be from that's why like cerebral angiography, I'm not ruling out. And it could be something like in that circle of Willis. Why would someone get left-sided ocular motor nerve palsy? So like cranial nerve 3 on the left side. Why would you get that?
You're on the right
Thinking
track.
too much of like a yeah, I'm thinking too much of like a Bell's palsy where it's cranial nerve 7. I'm like, okay, that one makes sense to me. This one, hmm, what happened? What happened? You might want to get a cerebral angiography to see what's going on.
Okay,
But
final answer.
yeah, I'm trying to think if it's like one of these Berry or saccular aneurysms that I can't
Okay,
quite pinpoint. I just have like a lot of like those thoughts. I'm like, I'm trying to,
sure,
I'm because
sure,
I don't know the diagnosis.
sure.
Um, CT is never a bad idea, and MRI with brain stuff's never a bad idea. So, um, but yes, maybe, yeah, maybe the cerebral angiography.
Okay, so let's talk about
Oh,
this,
CT
right?
scan.
So this is kind of interesting, right? Suggestion of pituitary apoplexy, right? Meaning that
Oh,
so the
okay,
pituitary tumor or pituitary, I wouldn't adenoma, right? Got blood in it and then rapidly expanded, right? So it has a hemorrhage or an
okay.
infarct, right? And
So it's
so
almost like a Sheehan's, like in
yeah,
that
exactly.
regard.
Exactly. Yeah,
Okay.
exactly. It's kind of like a Sheehan. So the trick here is what you were thinking about is like a subarachnoid hemorrhage from the circle of Willis from like a ruptured berry or sacral aneurysm,
That's
which
exactly what I was thinking about.
yep.
Yes.
So that's a good freaking thought. Okay, I like that a lot. Okay,
Okay.
but it
Okay.
doesn't tie into his history of a pituitary adenoma, and so that's why it's
Okay.
kind of it's not a bad answer. I like it. I like the train of thought because
Okay.
usually those patients will have severe headache and it's going to knock out the cranial nerve 3, but it doesn't explain his hemianopsia, right, which is from his pituitary adenoma.
Correct.
Okay, so you want to
Correct.
pick something that kind of wraps it in kind of a little gift, right? And so the best thing here, right,
Okay.
to see kind of that blood right there, a fast, easy, and cheap way is going to be a CT scan. Okay, that's the
And it
fastest.
makes sense. And you would do the CT before the MRI, I
MRI.
guess, if you couldn't figure it
Bingo.
out. Okay.
Bingo. Yeah,
Okay.
because if you're like, oh, I don't see enough and he's stable, then you'd run the MRI next because CTs are good for
Okay.
like, generalized, or for the most part, CTs are best for bone structures. And for two, right, if you run it with like contrast, then you can see, you can see vessels, you can see some soft tissue, you can see some bleeding, right? But an MRI
Okay.
is going to be the best for soft tissue, but it takes a long freaking time. So a CT scan, as you already know, can take 2 to 3 minutes, right?
90 seconds. Yep.
Yeah. But then an MRI, right? You're talking like 30 an hour and
Hour.
a half,
Yep.
right?
Yep.
So,
And
you
and then some patients can't do them, right? Like they're claustrophobic or
yep.
yeah.
Yep. So, patients that are claustrophobic, they almost every single one of them can do a CT scan, right? Because you sit there for 90
Okay.
seconds in a tube, it goes real fast and then they're done. But an MRI, people get anxious, a lot of people need
Hmm.
um, benzos to calm them down, right, while they do it,
Yep,
things
and
like
they're
that.
loud and
Yep.
noisy. Yeah, I had to get one time like this, or at one of my labs, my other labs in undergrad, we did that, and I was like we were doing like brain imaging stuff, and I did it just for like reference, and it was awful.
Yeah, no, it's not fun. Yeah, it's not fun for sure.
It
So
was
good.
awful.